I'm so pleased to be joined by Congresswoman Yvette Clarke, who has really been a champion at all times, but especially during this pandemic for mental health and for mental health parity for everyone. I know that so many people are struggling. We're seeing a rise in anxiety and depression. What are you seeing in your district, and what are some of the coping skills that you've been helping people with?
Well, we here in Brooklyn, Congresswoman, are in the epicenter of the epicenter
Yeah.
of the pandemic in New York City. We're in Brooklyn, New York. We live densely populated, very large families in very small quarters. And what we're seeing is fear, anxiety. We're seeing overwhelmed individuals, anxious individuals, because every day we're facing the specter of someone we know or ourselves becoming ill with COVID-19. We're
Yeah.
seeing food insecurity and families that now have their children home all day, uh, just circumstances that no one could have ever imagined and that have really upended our way of life. And so that's why mental health and checking in is so very crucial right now.
I know that you have also been working on mental health disparities, and much like this virus has disproportionately affected communities of color, what are you finding with people's mental health status and with their ability to find help and resources?
I find that particularly given the cosmopolitan nature of Brooklyn and our immigrant and ethnic enclaves, again, they're not accustomed to seeking out medical mental health treatment. And so it's something that we really have to emphasize and re-emphasize again for those who may not uh, necessarily have that as a cultural dynamic that they're accustomed to. So as we discuss the need to protect these marginalized communities and communities of color in the face of this devastating pandemic, we must ensure that we include the needs, of course, of the LGBTQ community during this time as well. I think it's important that we wrap our arms around everyone in our communities during this time, that no one suffers alone, not knowing how to connect when we're asking people to stay home. It can be quite isolating.
One place that you showed a lot of leadership was around developing the HEROES Act. There is $3 billion in that bill for mental health supports, and I'm so grateful, and all of us are so grateful for how hard you pushed for the inclusion of that, and remembering our community health centers, suicide prevention, a whole host of programs. So could you speak a little bit about the importance of making sure we can get this funding through the Senate and signed by the president?
Absolutely. Congresswoman, as vice chair of the Committee on Energy and Commerce that has jurisdiction for healthcare, we knew it was critical that we address the whole person. And we, of course, are overwhelmed by the physical manifestations of what the coronavirus, COVID-19, has done to our communities, to our human family. And what we've done through the HEROES Act is to invest into local and state services, research, and resources to better understand and manage the stress and difficult emotions people are feeling during this crisis. For communities of color, these anxious feelings are heightened as they hold many of, unfortunately, the low-wage jobs, the essential jobs, as well as jobs in companies opening up prematurely without proper testing and protection. The HEROES Act really hits a sweet spot when it comes to looking at and recognizing the fact that we're going to need help, and we're going to need help going through this pandemic. We're going to need help coming out of this pandemic. And we need to build out a robust healthcare infrastructure to meet the needs and demands of those communities that have been so severely impacted by the COVID crisis.
Yeah, well, thank you for your work on this. I know that you've been doing so much from your beautiful home there on trying to get information and education out to people so that they don't feel so isolated, and really all your work over many years breaking down the barriers and stigma around seeking help, that mental health conditions are, as you know, on equal footing with the physical health crisis, and we need to see them that way and have the policies in place to enable people to access the care that they need.